A liquid biopsy is a new technology in medicine. With any new technology, there comes new knowledge and understanding, which guides new thinking and doing. The new knowledge in liquid biopsy is very clear. ctDNA shedding in the plasma reflects an aggressive underlying tumor biology, which is associated with poor treatment outcomes across all stages. A liquid biopsy identifies the more aggressive tumor clone that needs treatment. If you treat lung cancer without knowing the tumor biology, without a liquid biopsy, your patient has a poor outcome.
Circulogene provides the most comprehensive serological testing assessing DNA and RNA, giving the patient's treatment team timely and critical information to create a comprehensive treatment plan. Serologic molecular testing at the time of biopsy allows me to efficiently provide my oncologist with the pivotal information needed to complement the tissue diagnosis and mediastinal staging.
As a medical oncologist, I need to know the full tumor biology, including where there is ctDNA shedding, to decide the best individualized treatment for my patient. It is important for me to have results by tumor board, to have these discussions from a multidisciplinary perspective, to know what best treatment option is supportive of my patient's treatment plan.
We chose Circulogene to guide the need for neoadjuvant treatment and timing of surgery. Pre- and post-surgical testing can guide the need for post-surgery treatment and also indicate the intensity of surveillance follow-up. Circulogene testing is also useful to determine node-negative patients that need systemic treatment. If they are node-negative and still shedding, it could indicate that they are at high risk for recurrence. Circulogene is also useful to test longitudinally over time for recurrence.
So you may ask me, why Circulogene? And the answer is the following. Number one, because it's easy to implement in the endoscopy suite at the time of diagnosis. You get your tissue biopsy as well as your blood biopsy at the same time. And number two, because it includes a PD-L1 in the panel as compared to others that do not. And that's an important information about tumor biology, as we said before. Number three, because there's a very good support from the institution for the data collection and for the communication between the proceduralist as well as about the data coming back to them. And four, which is last but not least, because it's the right thing to do for our patients.
Circulogene's upstream process provides non-disruptive flexibility for the clinicians. It's next-generation sequencing that provides us imperative data for our patients. This is how we get individualized, personalized treatment. We utilize this Circulogene for PD-L1, which is imperative for immunotherapy. It provides support for making really extensive and important decision-making for our patients from a clinical perspective. It provides everything that we need from a liquid biopsy perspective, utilizing all the mutations that are looked at commonly for making treatment decisions. Most importantly, it's because it matters. It matters for our patient's success, it matters for our patient's treatment options, and it matters for our patient's overall survival.
It is very important to have a liquid biopsy at the time of the treatment discussion and decision, because that is vital for any lung cancer program to improve lung cancer survival. A programmatic approach of drawing a Circulogene liquid biopsy at the time of the tissue diagnosis is the best way to achieve that across all stages. What imaging and tissue staging misses, a liquid biopsy sees. A liquid biopsy, because it matters.